Hello, everyone. Thank you for joining us today. We're so happy to have you with us. I am stepping in for Dawn real quick. We're getting her over here. She's going to help us with Q&A afterwards. And it is my pleasure to help introduce in the meantime. I'm so honored to introduce Dr. Edelson, and he's an assistant professor of pediatrics at the Perelman School of Medicine and a cardiologist in the Division of Cardiology at CHOP, Children's Hospital, Philadelphia, with a clinical focus on heart failure transplants, mechanical circulatory support, and exercise physiology. He is the medical director of the sports cardiology program and believes that a safe and effective form of exercise can be found for all children. It is also my honor to introduce Dr. Kogon, Amy Kogon, who is the attending physician in the Division of Nephrology, at Children's Hospital of Philadelphia. She will be talking to the abdominal side of sports and transplant. We are so happy to have you both with us today. Dr. Edelson, if you wouldn't mind, you can begin.
Thanks very much. I appreciate it, Melissa. All right, I'll start by sharing my slides and we'll see if that works. All right, so that was a very generous introduction. I appreciate it. I just want to start by thanking you for having me here, for everybody for joining this session. You know, of all the things that I get to talk about, this is among my favorites. And this is a wonderful program, and it's a real privilege to be a part of it. So the title of the talk today is Activity in Children After Heart Transplant. And in my mind, this is a really important and often under-recognized way in which we can improve the outcomes of the children that we take care of. In terms of what I'll be talking about over the next 15 to 20 minutes, I want to start a little bit by discussing the background and rationale for this talk. I'll talk a little bit about some of the preliminary research that's been done, in addition to the current studies that are being done on exercise in this group. And weave in with those some real world practical lessons and advice and the things that I've learned over my early career before concluding with where we're going in the field. But I think even before I turn my attention to those things, I just want to tell you a little bit more about who I am. So as Melissa said, I'm a pediatric cardiologist. I do transplant medicine, and I did training in exercise physiology and formal training in epidemiology as well. But I'm a parent, and I'm a teacher, and I'm a coach. And my wife says I should start to put former next to athlete, but I still think of myself as an athlete. And I bring those things up because I think that, you know, those bullet points on the bottom of this slide honestly influence my practice on the top of the slide as much as any of the formal training or clinical experiences that I have. And so I'd sort of keep that in mind as we make our way through this talk. So, you know, as I'm sure many of you know, the transplanted heart generally pumps totally normal after a heart transplant. And in fact, the American Heart Association recommends no specific exercise-related restrictions for people after they have a heart transplant. But as I'm sure many of you also know, the pot of gold at the end of the rainbow is a little bit of a mixed bag. So children after a heart transplant don't exercise as much or as effectively as their peers. This is a small study that just looked at the exercise performance in children at CHOP after their transplant. And what I wanted to show here is that the vast majority of children who were formally tested performed lower than you would expect from a peer with their own heart, and that there was nobody who was a high performer in this sample of 30 patients that we looked at. And that's a problem. It's a problem for a number of reasons. It's a problem because exercise has critical impacts on physical health. You know, there are a number of reasons that transplant patients have increased rates of hypertension and hyperlipidemia, increased rates of obesity, and many of those are out of their control. It's the medications that they take, but exercising mitigates some of those things. Similarly, as everybody knows, one of the reasons that grafts don't last as long as a natural heart is because they develop graft vasculopathy. And so exercise is one of the ways that we can protect the coronaries and keep them as healthy as possible. And then I think just as important is what you see on the right-hand side of the screen, which is the inextricable tie of exercise and mental health. So for any number of reasons, and with many good reasons, there are increased rates of anxiety and depression in children after transplant. And we know that regular forms of exercise improve mental health, which ultimately improves adherence and graft function. And so if we want to move the bar that you see on the bottom of the screen, which shows that children after transplant have a quality of life that is similar to those with the most severe forms of palliated heart disease, then we really need to figure out ways that we can leverage actionable items that will improve their mental health. In terms of the things that I've learned from the kids that I've taken care of, and I'll come back to this a little bit, I think that there are a number of reasons that our patients don't exercise as much as healthy peers. So one is that children are scared and worried. Many of them before their transplant course were told to exercise great caution before doing anything that would put stress on their heart. Two is that their parents are worried. They're scared and they're anxious, and I can understand that too. You know, they've had a child who they've taken care of for some period of time who was so incredibly ill that they needed this incredible therapy, and they want to take good care of that. The last thing they want is for their child to be at increased risk. One of the things I think we don't think about quite as much in our kids is that, you know, many times they learn habits and develop skills in a very different way than children with a typical heart will. So whereas many children may participate in Little League and travel soccer and gymnastics and dance from the time that they're very little, they'll be full participants in, you know, gym class and a number of other things. Many patients who have the severity of heart disease that requires a transplant aren't able to do those things. And so they don't grow up learning the rules of the game, learning the skills that allow them to participate once they have a new heart. It almost would be like me moving to India now and trying to play cricket when I've never played before. It's very hard to jump in late in the game. And then I think the fourth thing that we don't always talk about as much is the fact that, you know, cardiac rehabilitation is the standard of care for adults who have heart disease, but it's much more heterogeneous and varied in the pediatric community. And while some centers and many of the big ones do have cardiac rehabilitation, many centers don't. And even for those that do, we ask a lot of parents for them to take their children in multiple days a week for a cardiac rehab program when they've already taken so much time away from work, away from their own lives, away from their other family members. And that's a real challenge. But there is always hope. This is a piece of art that hangs in our office that I often remind myself of and why I'm doing what it is that I'm doing. So, you know, I think in every challenge, there's significant opportunity, and the lack of activity in our patients is no different from that. So, you know, just in the way that we know that a lack of physical activity adversely affects graft health and psychological well-being, it means that physical activity is something that we can leverage to improve graft health, to improve mental health, and to give kids a better quality of life. You know, when I think about exercise, and I hope this is one of the take-home messages here, there are so many things that are really beyond our control after heart transplant. You know, there are many things that even, you know, if we do everything that we're supposed to do, we can't always prevent. But this is one of those places that we can have a true positive impact. The things that we do on a day-to-day level can affect our life. And I think that that's a really valuable, and for me at least, comfortable thing. So when I sort of began to get engaged in this as an idea and tried to think about how I could help my patients be more active and exercise more, I realized relatively quickly that I needed to ask them why they didn't exercise or why they might want to exercise before trying to come up with any ways to help them. And it was really interesting just to do a little bit of a you know, question and answer with some of my patients, and you know, be curious to hear what other folks have come across. But these were some of the things that I heard. I always wanted to exercise after transplant. I couldn't do that before, and this was my chance. I would have liked to participate in something like an online virtual program because that's easier and it's motivating for me. I need some guidance. I want to find a way to develop a habit of exercising, and I want to be able to see the results. Ultimately, went ahead and categorized the feedback that we got into 3 critical areas from patients and their families. One was safety. People want to be able to know that the things that they're doing are not putting the great gift that they have at risk. The second is education. People and patients want to know how to exercise, not just what's safe, but how to perform many of the things that we take for granted. And the third is access. The inability to access cardiac rehabilitation programs in a way that is not a tremendously cumbersome and difficult thing for families is really limiting the way that they came into exercise. So turning back a little bit just to the sort of the nuts and bolts of this, is exercise safe in heart transplant patients? Yes, unequivocally yes. Now, there are important caveats here. Every child is different. So in the things that have come up, so sternal precautions, there seems to be a great deal of center variation in this, actually. So all centers will have a period of sternal precautions after the transplant until the sternum has healed adequately. And then there are certain centers which, no matter how long you are after your heart transplant, prefer to avoid any activity that involves potential trauma to the chest, like football or lacrosse. There are other centers I've seen that like to put chest protectors on their kids who participate. But I've certainly seen transplant patients who have participated in college hockey, college soccer, competitive lacrosse, and any number of other high contact sports. I do think that some of the specific cardiac level risks that I think about and take into account are histories of arrhythmia, any amount of heart block, or bad graft vasculopathy. Those things certainly alter the way that I might talk about exercise with my patients. But as Melissa said in the introduction, I'm sort of the belief that every child can find some form of exercise that is safe and effective for them. And that it's just sort of, it's about figuring out what is going to be safe and what it is that they're going to get joy from and bring them closer to whatever exercise related goals that they have. You know, we talk a lot about the heart, and I talk a lot about the heart, but sometimes I think we don't think about some of the extra cardiac risks that are really important. So often families ask them like, all right, well, how can I keep my child safe? And these are some of the things that I tell them. The first is start slow. You know, many children who are thinking about getting into exercise after transplant are recovering from a major surgery and may not be highly conditioned. So you don't need to go out the first day and run 10 miles. You don't need to go to your first soccer game and play all 90 minutes. And I think also being gentle and forgiving with yourself as you're starting to move forward in an exercise path is important. Remembering that just showing up is a win. So not being down on yourself if you're not the fastest off the bat or the best soccer player off the bat. Secondly, I think you really can't ignore symptoms. You know, this is a case where it's important to be honest with yourself and to tell people if you're feeling things. You know, part of becoming an athlete is learning what are warning signs and what are dangerous symptoms and what things are just the side effects of working really hard. But many of our kids are going to be learning those lessons a little bit later in life than we might have. And so I just encourage an open dialogue with your parents and with your cardiologists. The other piece that's really important, so for any of you who played high school or college sports, you know, at least my locker room looked a lot like the one on the top left-hand side of the screen. It was disgusting in there. And there is a lot of staph that lives in those rooms in addition to other bugs. Remembering our kids are immunosuppressed, and there's certainly a greater risk for infection. So you got to wash your uniforms after the game. When you've got open wounds, you've got to put topical antibiotics on them if they need it and cover them appropriately. And then I also urge my kids to sort of be careful in the places that they're swimming, particularly standing water can carry a great deal of infectious risk. But the most important piece, I think, is the bottom of the screen. You know, I don't know any cardiologist whom wouldn't be excited and encouraged if you came to them and said, I want to find a way to exercise. What can I do? So as I said, there is lots of hope. There is good research being done out here. This was a really nice study that was done out of a group at Stanford. It's small, but they piloted a virtual one-on-one exercise program with transplant patients that took place over 3 to 4 months. It was worked in with a series of dietary modifications and nutritional counseling. And I just want to point out on the right-hand side of the screen is that after the intervention, children's BMI went down and stayed down significantly. And that after the intervention, children's physical functioning scores went up and stayed up significantly. And I think really the moral of this story is that this can be done. If we come up with the right programs to help our kids exercise, they can do so effectively. In terms of what we're doing at CHOP right now, so this is a study called MIGHTY. It's a collaborative study that involves psychologists, exercise physiologists, in addition to our transplant group. And what we do is a group exercise program that we deliver via video conferencing with a number of our transplant patients. So essentially, the way that it works is that they get together as a group after school, anywhere between 4 and 6 transplant patients. They see each other via Zoom, just like this, and they see our exercise physiologist. And then our exercise physiologist works them out for half an hour. The idea is that they can see other kids who are doing the same things that they're doing, It increases the social incentive, and I think it increases the joy of participating in what they're participating in. And then they work with a psychologist, and the psychologist's job is to help sort out for them why they're exercising or why they're not. What are their barriers or motivations? Along the way, they gather a series of reward badges for participating in enough classes, for taking enough steps, or for sort of having their best class. And some of these themes may ring familiar for you, and that's because what we did was we sort of shamelessly borrowed lessons that we've learned during the pandemic from things like Peloton. And I can't speak to how everybody else in this audience feels, but I know that like I value my weekly Peloton streak. And so when it's a really busy week on service, but I see I'm starting to get towards the end of the week and I notice that I haven't exercised yet, one of the things that pushes me to go forward is to make sure that I hit that number again. Similarly, when I'm doing those programs and I get a rewards badge, I feel good about it. And there's no reason that gamification doesn't work for our kids as well. This can be fun, this can be rewarding, it can be edifying. And we need to work in those things to the care that we give to our children. Additionally, during the program, we use a wearable. So our kids get a Fitbit. It just helps to guide their exercise. It allows us to get a sense of what they're doing and for them to give us feedback and for us to give them feedback on how their program is going. I think what it comes down to ultimately when I think about this is that any activity is good activity. When patients and families come to me and want to know how it is that they can exercise, one of the things that I say is you're not going to exercise unless you're doing something that you enjoy. So think about the activities that you like to do or the things that you would like to be good at and anchor to those. And exercise is a really big topic. It doesn't have to be an organized sport. It can be walking the dog. It can be exploring different places to go hiking. It can be dancing. I think the other thing that I tell them is you need to find your purpose. It's really important to have an exercise-related goal. So when I first meet with a family and our child to talk about this, that's one of the things we spend a lot of time going over. And often, the teenagers in particular can be a little bit shy and reluctant to share this. But the things that tend to come up are, I really would like to be able to make a team, or I would feel so good about myself if I could finish a race. The other thing that comes up all the time is I want to look better in the clothes that I wear, or I want to feel more confident walking into the classroom. And I think that sometimes the kids we take care of feel embarrassed to say those things because they think it's not sort of a grand enough reason. But in my opinion, it's totally untrue. If that's an important goal, there's certainly nothing wrong with wanting to feel more confident and feel better about yourself. And if that's going to allow you to engage in healthy activities, then go for it. The third thing I emphasize is that we know that families that are active together are more active. So do things as a family. Go out and hike together, go out and walk together, go out and dance together. All of those things are more likely for your kids to exercise more. And then finally, as I said, talk to your cardiologist. Come up with a plan. Cardiologists love patients and families who are motivated. And anytime you have the ability and the opportunity to come in and say, like, this is something I want to do, how can we make it work? I can't imagine any physician who wouldn't be eager to partner with you on those things. All right, so I'm almost to the end here. I want to make sure we get to Amy's talk. The things that I would hope that everybody can take home here is that exercise is safe, that it's critical for our patients in terms of their physical and mental health, that it's an opportunity for our kids to improve their outcomes and for us to help them do so, that our field is growing and evolving, and we are doing a much better job of figuring out to help and support our kids participate in safe forms of exercise. And then finally, this is an opportunity. This is a chance to take control of your health. So go out there, find something you like doing, find an exercise-related goal, and be active. In closing, I think many of you have seen this slide already, but I just wanted to remind folks of the PHTS Patient and Family Council. We all really appreciate the input of the families we take care of, and the things that we do are far, far, far more effective when we have your input and your guidance. All right, I'm going to stop there. I have my email up there. I'm happy to take questions at the end of the session, and please feel free to write to me with other questions as well. But as I said, it's really a pleasure to be here. I'm looking forward to the next talk.
Great, thank you. You can see my slides, okay?
You're good to go.
Okay, great. Oops. So my name is Amy Kogon, and I'm one of the pediatric nephrologists at the Children's Hospital of Philadelphia. And I am really grateful for this opportunity to talk to you about physical activity in kidney transplant recipients. Since I'm a nephrologist, that's what I will primarily talk about, although I have a few comments also in regards to liver transplant recipients. And I'm really excited to talk to everybody, and I look forward to any of the questions. So thank you for this invitation. So what I'm going to talk about today is why physical activity is important in transplant recipients, how to engage safely in physical activity, types of physical activity, and review some strategies to making physical activity a part of your life. So children and adolescents with chronic kidney disease don't get enough physical activity. The U.S. Department of Health and Human Services recommends 60 minutes of moderate to vigorous physical activity a day. One study that looked at adolescents with chronic kidney disease found that only 13% of them are meeting these recommendations. And that was actually, although most of the United States does not get very much physical activity, that was much lower than the average reports. And in addition, 98% of adolescents with chronic kidney disease exceeded the recommended screen time of 2 hours a day. So I think this is a major problem for kidney transplant recipients. Cardiovascular disease is the main morbidity and mortality in people with living with kidney disease. Living with kidney disease increases risks for high blood pressure, lipid and cholesterol problems, and diabetes. And some of this is related to underlying kidney disease where there's impaired and abnormal metabolic function. But it's also related to a lot of the medications that transplant recipients are on, and also to overall inflammation in the body as a result of having kidney disease. Physical activity, though, improves cardiovascular health. And this has been shown very broadly in the general population, of course. And so there's less research in this in the pediatric transplant recipient population, but I think we can assume and surmise that it will be true for our transplant recipients, and we're working on more research to better define these improvements. So there was a study in pediatric transplant recipients that looked at the physical fitness of the transplant recipients compared to a group of controls. And what they found was that the renal transplant recipients had reduced maximal oxygen consumption. Maximum oxygen consumption is generally considered the best indicator of cardiovascular fitness and aerobic endurance. So that indicates that they're not doing as well in terms of aerobic and cardiovascular health. They also had lower peak heart rates. The patients who were engaged in higher levels of physical activity had better physical performance, so we're stronger and able to perform tasks better. We also know that, unfortunately, there are many pediatric transplant recipients who report lower health-related quality of life. And what they found in this study was that those who weren't doing any physical activity had the lowest quality of life. There's many benefits to physical activity, and these benefits exist for everybody, but in particular, they're important for patients who have had a transplant. So one benefit is improved muscle function, better blood pressure control, which is really very important because we know that having kidney disease is a major risk factor for having high blood pressure. And so physical activity can really help to reduce that risk and better control blood pressure. It improves muscle strength. Physical activity lowers cholesterol and triglycerides. For many people, it allows them to sleep better at night. It improves bone health, which also is very important because specifically for kidney transplant recipients, we know that the kidney is involved in a lot of bone health regulation. And so physical activity can help offset some of those problems. And in addition, a lot of the medications that patients are on, all of transplant recipients, including prednisone, are bad for bones. So physical activity can help reduce that risk. It also can provide better control of body weight. And I don't want to focus too much on weight because I really think that the benefits of physical activity exist outside of whatever your weight is. But I want to bring up one point is that obesity in pediatric kidney transplant recipients is a pretty big problem. And we know that in the first year after transplant, the prevalence of obesity, so the number of people who are obese, doubles in that first year. So there's a lot of weight gain happening in our patients in the first year after transplant. And this one particular study looked at the difference in weight after transplant or the difference in BMI after transplant to pre-transplant. And what they found was that the patients who were gaining the most weight actually had this significantly shorter graft survival. So their kidney didn't last as long if they were gaining more weight in that first year. So I think physical activity is important to also help to control weight gain. So there's two major types of physical activity. Aerobic, which is continuous activity of large muscle groups, and that's things like walking, swimming, bicycling. It's often also thought of as cardio, and that's really great for blood pressure control and overall health fitness. There's also muscle strengthening exercises, and that's when the body's muscles work against an applied force. So things like lifting weights, using resistance bands, push-ups, sit-ups. So those both types of physical activity, as Dr. Edelson said, any type of physical activity is good. They do have some differences a little bit with the muscle strengthening, maybe has more benefits for certain metabolic functions, but they're both excellent. And so using both are great. I will say though, that with muscle strengthening, I would often counsel to avoid heavy lifting as much as possible because of the abdominal surgeries. You want to keep everything together. And so sometimes it can be more beneficial or safer to use low weights with many repetitions. So to speak a little bit more about the safety of physical activity, we know that the transplanted kidney is in the pelvis or abdomen. It's not in the back behind the ribs, which is where typically kidneys develop. And so the ribs are good protection. This kidney in the pelvis or abdomen is not as well protected. There's nothing really between whatever's happening on the outside world and your kidney. You can often feel it right under your skin. And so we generally say non-contact sports and sports that don't include high risk of falling are best. Of course, there are ways to do that safer. So wearing kidney shields can definitely help reduce some of the risk to the kidney in these instances where you're participating in activities that do carry those risks. So in general, I would say we avoid it as much as possible, but it's not an absolute ultimatum, and different centers and different physicians will have different guidance about that. It's also really important when engaged in physical activity to drink lots of fluid. Specifically, water is a good fluid to stay hydrated. So the transplanted kidney is amazing. It's a great kidney. It's keeping you alive. It keeps your child off of dialysis. The one thing it doesn't do that well is concentrate the urine. And so the transplanted kidney doesn't always hold on to water as much as a native kidney will, or a kidney that doesn't have kidney disease in it. And so what happens is you tend to pee more than you would otherwise as when you have a transplanted kidney. And so if you're engaged in physical activity and there's a lot of sweating going on, a lot of hard breathing, you'll lose more fluid. And so your kidney won't really keep the rest of the water in as well as you would want. And so resupplying that water as you keep peeing and sweating and all that is really, really important. So definitely drinking lots of fluid while active is important. I spoke to some colleagues who take care of children with liver transplants, and they also say they recommend avoiding contact sports as possible, particularly in patients with an enlarged spleen or those with a low platelet count. And they also commented that there are, again, like guards to shield these organs and to help protect them. So I wanted to touch a little bit on dispelling myths. So one is about this contact sport. So we really want you to protect your organ and not do unnecessary damage to it, of course, but we want you to live your life. And so wearing a kidney shield if you're engaging in high risk activities, I think can be helpful. And also thinking about how to engage in those activities in a more safe manner. For younger children who receive a kidney transplant, we might hope that the parents direct them more to safer activities. So instead of like pushing your 7-year-old to do football, it could be helpful to push them to do swimming or running or something that is a little bit less, that's a little bit less risky. But we don't want you compromising your quality of life and happiness. We want to work together to find ways to optimize safety. And so, for instance, if you are a skier or snowboarder and that is your life, because then maybe we can work together to find a way to make that safer, wearing a shield, avoiding riding on the rails or something where you could fall and get hurt. Because we know that a lot of our patients actually have already developed an identity related to their sports. And so we don't want to take that away. And I have this picture here of Chris Klug, who is a snowboarder. And in 2000, he received a liver transplant. In 2002, he competed in the Salt Lake City Olympics and won a gold medal. And I think he was the first one to win a gold medal. So it's definitely possible. Also, I want to talk a little bit about how exercise is good for the kidney, not bad for it. And so, like Dr. Edelson, some of our work has involved talking to kidney transplant recipients and talking to children with adolescents with kidney disease, and understanding what they see as barriers to doing physical activity. So one thing that comes up is weightlifting. So immediately post-op, there's going to be restrictions. So maybe the first month or 6 weeks, you're told not to lift anything over 20 pounds because they've just closed all these pieces of your belly and your body, and we want to keep everything together. But eventually that eases a bit. And so it's possible that in that initial post-transplant period, you're being encouraged not to do certain activities, and then it sort of feels like you're not supposed to do those activities ever. Also, you're not going to tire out the kidney. Keeping it well hydrated is great, but maybe you're out there running and you're out of breath and you're huffing and puffing and you feel like you're really tiring out. Your kidney's not feeling that. So that's okay to be out of breath and to feel tired with exercise. Of course, we don't want you torturing yourself or overexerting yourself, but that's just like the same rule applies for everybody doing exercise, not just recipients. So you can go out there and do your exercise how you would, or activity how you would normally, like anybody else. And then the other thing that was interesting for us to learn was that some people thought that maybe having more muscle mass is actually bad for your kidney. I thought a lot about that and like where that message came from. And I think maybe that it's related to the fact that we measure kidney function with the creatinine, a blood test, the creatinine. And creatinine is a byproduct of muscle. And so the more muscle a person has, the higher their creatinine. And that's why creatinine increases with age through childhood. But it's reflective of muscle mass or dependent on muscle mass, but it doesn't necessarily mean that because your creatinine is higher, because you're more muscular, that your kidney function is worse. And so talking to your physician about what it means if you're starting an exercise program and you think you're actually bulking up a lot. And also we have other ways to measure kidney function, like the cystatin C, which does not involve muscle mass. And so having muscles is good for your kidney. It is not bad for your kidney. And I just wanted to put a shout out to the World Transplant Games. So this happens, I think, every year, and it's for children and adolescents 5 to 17 years of age, the pediatric portion. Once you're 18, you can be in the adult portion, and it has summer and winter sports, including skiing and snowboarding. So these sports that maybe are thought of as being more dangerous. And I encourage those of you who have an identity related to a sport or want to develop one to apply for that. And you can see these transplant recipients, like the one little girl in the upper picture, you can see it received the liver. So for those of you who aren't already doing a lot of physical activity, I wanted to talk about some ways to maybe get started. So what we recommend is making it fun, because the last thing we want to do is to feel tortured and bored. Sometimes making it a family activity, making it social, having a consistent schedule, and engaging in it gradually. So make it fun. So some ideas would be to join a team or a club. And it doesn't have to be a particularly competitive team or club. For instance, a lot of areas have recreational teams that you could join. Working out with music, TV, reading, podcasts, that can all make it more enjoyable. I enjoy running, so I always listen to the music when I'm running. And in the winter, when it's very cold, I don't like to run. And so sometimes I'll do the elliptical and I watch a TV show. So like finding a TV show that you like that has a series or something, and knowing that you're only going to watch it while you're doing your exercise. That can be podcasts you're only going to listen to while you're doing exercise. That can be a little bit of extra motivation to get out there. and do some physical activity, or and also being in an interesting location. So not the, the gym staring at a wall, but going for a walk in the woods, in a garden, at the mall, around stores, an interesting part of town, that kind of thing. It's also good to engage the whole family. So studies have shown that children's physical activity levels mirror their parents. And so getting everybody involved is going to be helpful. And everybody benefits from physical activity. Even if you're already doing physical activity, doing it with your kids is going to be beneficial. So going for a walk after dinner every night, taking on the weekends, finding a nice place to hike in the woods, going on bike rides together, playing soccer in the backyard, things like that. Don't require a lot, but you can do it together and have fun. I think making it social can be good, especially for adolescents and children. So team sports can be good from that perspective. Even just finding a buddy to walk with or to jog with can be really helpful. 2-on-2 sports with a friend, so tennis, playing basketball, catch, whatever. Doing it with somebody else can really help make it more fun. And then consistency. I really think that one of the hardest things about doing physical activity is having, like, if you're gonna, and specifically like exercising, is to actually go do it. I think it's that initial step of doing it. And so I find it really useful for patients to pick a specific time, activity in place to do this every week. So for instance, you know that on Wednesdays, when you come home and you get off the bus, that's when you and your friend go and play tennis. And it doesn't matter that, someone asks you to go to the ice cream shop, like this is what you do. And so I think, and then, like, you don't have to decide every day. It's very, very hard to decide every day whether or not you're going to exercise. And that's why I think finding the specific time that you're going to do it so that you can just kind of get in there and do it can be really helpful. And then lastly, you don't have to do it all at once. So the recommendation is 60 minutes of moderate to vigorous physical activity a day. There's some studies that have found that in adolescents that correlates to 10,000 steps a day. But you don't have to turn around and do that every single day. Pick one day a week that you're going to do that, or pick 5,000 steps a day and start with a small change and then build up to it. So in summary, children with kidney transplants have accelerated cardiovascular disease, and physical activity is a really important way to reduce those risks. We also know that healthy weight probably increases the survival of your kidney graft. I also want to emphasize that physical activity is safe for transplant participants, and definitely talk to your doctors about ways to engage in activities that you enjoy. But it's very important to find something you enjoy and to make a plan to stay active. Physical activity will improve your physical and mental health. So we spoke a little bit less about the mental health piece of it, but it definitely helps with anxiety. And sometimes that can be a real motivating factor to doing the physical activity. So thank you very much. I'm happy to take any questions or comments, or feel free to connect with me by email.
Thank you so much, Dr. Kogon. This is awesome. We're still trying to get Dawn on. I know she's been having some technical issues, so we are working on that, but I will ask some questions in the meantime. We have lots of them, which is great. The first one is, it seems like lots of doctors are allowing transplant patients to do more and more sports activities now, but are there any things that we shouldn't be doing at all, like for our transplant kids, they shouldn't be doing?
So I guess I'll start here. I think, it's a marriage between the kid and the activity. So there are probably certain activities that for a given kid wouldn't be the right activity for them. So, a child who has bad ventricular arrhythmias or progressive graft vasculopathy. But in terms of the activity itself, there are very few, if not no activities I can think of that would, for me, be off the table entirely for a transplant patient. I think like stagnant water would be something that I would probably shy away from, but most of the activities you would do there, you could do in other types of water as well. So in my mind, probably not.
That's funny. That's a question coming up shortly, so I will ask about the stagnant water in a minute. No, that's great. Dr. Kogon, did you have anything to add? And if not, it's okay, I will move on.
No, I think the same way that it's hard to have an absolute. There's certain patients where we may not want them doing certain things, but it's definitely a discussion, and it's a shared decision It's a shared decision. with the physician and the families. And so hopefully that's not holding anybody back from being physically active.
No, that's great. That's good to know. The next question is for Dr. Edelson. How soon after heart transplant can a patient exercise?
Yeah, so I mean, some of that depends on what you mean by exercise, but I like to get my kids as soon as they are able and recovered enough to start walking, and then to increase the amount that they're walking, and then even while they're still inpatient, doing intensive rehab. So we're fortunate enough that we have a really wonderful rehab staff. So for a young man who was transplanted very recently, he was somewhat deconditioned prior to his transplant, and he started doing between 2 and 3 hours of rehab a day, 2 weeks of his transplant. I would wait until the sternum is fully healed before doing anything more advanced with lifting or any possibility of contact, and that tends to be at least 6 weeks.
Wise advice. I often wondered myself how some of these kids could be playing football after a year of having a transplant. It's crazy to me that their sternum was cracked open and now it heals so fast. It's amazing. All right, so let's see. Okay, any experience with patients who have a liver transplant, kidney transplant, and heart transplant at different times, I guess, yeah. Trying to discern what that means exactly. Maybe multi-organ. I'm going to assume that that's what that meant. So is there any experience with, multi-organ transplants? And I, in fact, know one of our board members, her daughter had a kidney liver transplant and she participates in sports. So maybe address that.
Yeah, I think that certainly we have patients who have had combined, whether or not they're at different times or the same time. I think the guidance will be applied to both organs. So like if you have a newly transplanted heart, then that will probably supersede the kidney for a little bit in terms of the guidance because it's new. But overall, I think we really encourage physical activity in all these patients, and they're not more at risk because they've had more than one organ transplant.
Great answer. All right, here's the one we talked about earlier. We have always been cautious, but is it now safe for transplant patients to swim in lakes, rivers, oceans, and public swimming pools? I know those will be several different answers for those.
Yeah, I mean, I'll take a stab. I'm sure Dr. Edelson will say something similar, but I think, ocean, I think people aren't as worried about as long as like wounds are all healed and everything. Public swimming pools probably comes next in that list, but there are certain like GI type things like cryptosporidium that really do spread in the pools, and so if they're having outbreaks, then maybe avoiding the pools in those situations. And then lakes and rivers is really going to depend a lot on where you are. So not all lakes and rivers are the same. So I think it's something you would talk to your doctors about. And if they don't know exactly the answers, and they could talk to their ID colleagues, because there are certain diseases that we would potentially prophylax for if patients were swimming in certain areas as part of like a triathlon or something, for instance.
That's good advice. I know, because we often wonder, as long as it's running water, and I mean, I don't know, I wouldn't want to go in a stagnant water anyway. So, all right, let's see. That's a great answer. We'll go ahead and do some organs have more restrictions than others, assuming normal function of the transplanted organ.
It sounds like, I think I'm not an expert on this because I don't know exercise rejection in other organs, but it does sound like there's some different considerations and restrictions. So, I tend to be much less worried about direct trauma to the heart, right? Because, children have a sternum that heals over them, really protects that. Where I was really struck by Amy mentioning the importance, of avoiding potential, direct damage. So I think that there are probably going to be different things that you would think about. I don't know which organ is the most restrictive necessarily.
Yeah, I was going to say that too. And actually, one thing I was going to say in my talk, which I didn't say, was that as much as we talk about the possibility of injuring the transplanting kidney, and I'm sure there have been occurrences, I've heard stories, but and over my 10 years of taking care of kidney transplant patients, I don't think I've seen anybody who's lost a kidney related to a physical activity. And that's probably because they're taking good care of them and wearing kidney shields and being careful. But it's not like, you know, everyone who goes down the ski mountain is losing their kidney, or playing football is losing their kidney. But just to put it a little bit in perspective.
We are crafty because we're moms and we figure it out. Dawn is finally with us. Can you hear her? We can hear you. You're great. Oh. Okay.
Had a liver transplant at 10 years of age, and he is definitely ready to show eye contact towards, and mom is saying, no, 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 no. So it's football off.
Melissa, you may have to translate for us. We're having trouble hearing here.
Totally can. So she's asking if any like real like contact sports. Her son's a football player. He's a liver transplant recipient. He's amazing. And we talk often, me and her, about how both of our sons play football. Are there any like super hardcore sports? Because our kids are rough. And they like to go out and play. Her son's playing football. Mine's doing football and wrestling that are completely off, just off the table, that you would not recommend. Like if they decided, I want to be an MMA fighter tomorrow, like, would you say, no, you absolutely cannot do that? Speak to that.
Well, I don't think we would ever say absolutely no to anything, but it wouldn't be on the top of our list of activities. And we would talk about, but I think it's still important to be honest about what you're doing so that we can strategize together to make it as safe as possible. I did have a transplant patient once who was an MMA fighter, or whatever that was. That's the only reason I even know what that is. But anyway, yeah, I mean, I think that, yeah, as we've said before, like we want to work together.
That's a great answer. As much as us parents do not want that, if my son came to me tomorrow and said, I want to do this, I'd be like, I'd be in the background, probably me and Dawn both, yeah, saying no. So, right. So no, thank you, Dawn, for being with us. Yeah, absolutely. Are there, I think we asked that one. Let me ask one more. Where can people find kidney and liver guards for their transplanted children? And is there a protective device recommended for heart transplant recipients?
Well, I guess I'll answer first. So a lot of centers have groups that they work with. Like I know in Seattle and in Columbus, actually the physical, I think it's the OT, hand make the guards and shields. We use a company called Boston Orthotics. But I also wanted to just say that on the IROC website, there's a section on kidney guards that lists kidney guards that can be used and has the contact information for them. So that might be something to look into.
Great. Is there anything on the thoracic side we should know?
Yeah, so it's a good question. I know that there are some of my colleagues at other centers who will recommend that children after transplant wear like a chest protector. That's not been my practice, in part, there's not a reason why children who have had other types of heart disease repaired surgically. So children with tetralogy of Fallot or Fontan physiology, we don't routinely ask them to wear chest protectors when they exercise. So there's no reason for me to believe that the transplanted heart would be more at risk than a congenital heart disease patient who's been palliated. So I tend not to.
Don, thank you. A big high five for you being patient with us. Thank you so much. I'm going to go ahead and set you down a second. Thank you so much. And thank you, Drs. Kogon and Edelson, for joining us. We're just so grateful for you. This has long been like a session that we wanted to have. We hope that we can ask follow-up questions. There's so much that is possible for our kids, and we just want to make sure that they're out there staying active and keeping their transplants good for a lifetime.
Thanks very much for having us.
Yeah, thank you very much. It's a wonderful session. I really enjoyed being a part of it. So appreciate it.
Feel free to
Thank
contact.
you. Go ahead.
I was just saying, feel free to contact me for anything, anybody that has other questions.
Thank you both so much. With that, I'm going to go ahead and close. If anyone has any questions following up that you think of afterwards, go ahead and let us know and write us, and we will be able to send those on. Thank you all so much. And please join the next session coming up. There's so many good ones. Thank you.